Hello, my name is Christina and Director of Free to Choose Medicine. Welcome to a Heartland exclusive interview with Dr. Jane Orient, Executive Director of the Association of American Physicians and Surgeons and President of Doctors for Disaster Preparedness. Doctor, it's great to have you on to talk with me today.
Great to be here.
I wanted to start by asking about the current status of the Association of American Physicians and Surgeons' role in suing the government for not allowing doctors to prescribe hydroxychloroquine to patients suffering from COVID-19, even though this drug is approved by the FDA for safety and efficacy testing and is used for arthritis and lupus and has been used for malaria. Do you have any update on what's going on with that, or why, or where the status of the case is?
We filed for an injunction in the Western District of Michigan against the FDA's emergency use authorization for hydroxychloroquine, which restricts its use to hospitalized patients or who do not have access to a controlled clinical trial. That actually only restricts the use of the hundreds of millions of doses that are in the government strategic national stockpile. Physicians can theoretically prescribe this off-label to whomever they like, except that so many states, in fact, all but 4 states, have put severe restrictions on physicians' ability to prescribe, and they seem to be following the directive that the FDA has set in that emergency use authorization.
Okay, well, thanks for that update. And I also wanted to talk a little bit about off-label usage. I mean, from our opinion, it's very important that doctors are able to doctor, and healthcare is a very personal decision. And it's just important that doctors and patients are able to make decisions. And it sounds like in some states, that's not the case. Do you have any other comments about off-label usage of hydroxychloroquine or any other drugs, and why the federal government is putting out a directive to not allow, usage or access to this drug?
If we did away with off-label use, we would have to throw away most pediatric prescriptions and about 20% of all other prescriptions. Once the FDA approves a drug for any use as being safe, it will have like a use of a list of a few approved indications. But there are many other indications that are discovered, that are published in literature, that physicians find to be useful, but it just isn't worth anybody's while to spend millions of dollars to get an additional use added to the label. Doctors can prescribe as they wish. Companies are restricted in what they can say to advertise these additional uses. So this block on hydroxychloroquine really is unprecedented. It's draconian, right. It's tyrannical, and I think it's probably causing tens of thousands of preventable deaths.
That's horrible. Well, moving forward in terms of finding a cure for COVID-19 or treatment, or even other diseases for that matter, it's important in our opinion, or my opinion, that the FDA acts as a bridge to innovation and not a barrier. And it seems like in this case, they are creating a barrier for doctors to be able to prescribe and patients to get access. Do you see any other potential treatments on the horizon, or any other barriers to providing treatments for patients?
I think the FDA is always a barrier. I don't think it ever really expedites things. It doesn't discover anything. There are lots of potential treatments for COVID-19 as well as for other viruses, but mention of them is censored from social media. People's resistance to it would be a much greater if they were not vitamin D deficient, as most people are. If we had good vitamin D supplementation, fewer people would be getting sick. Hydroxychloroquine plus zinc, or just zinc plus other ionophores, that's substances that get the zinc into the cells, such as quercetin and other nutritional things, help. Intravenous vitamin C would probably cure a lot of people. It's being used in China. It's being studied, but hospitals, even though they have it, are not using it here for reasons that I think are incomprehensible. I think we could get people oxygenated with hyperbaric oxygenation. There are studies going on now with the use of low-dose X-rays to treat this. This was done back in the 1930s and 40s, before we had antibiotics. It cured viral pneumonia and bacterial pneumonia back then, but we just kind of forgotten about it. I think there are many, many interventions that have been proposed or even tried but that are not being used because physicians are terrified of the FDA and medical licensure boards for doing anything that's off-label.
Right. Well, thank you so much for this, interview and update on the status of your case. And thank you for your time and talking with us today. And I'm sure there'll be a future interview on the horizon, hopefully a positive outcome.
I think we really need to let doctors treat their patients.
Yeah, absolutely. Do you have any other final words?
I think that things go very slowly in the courts. I think the best thing that can happen will be for the president to have an executive order making hydroxychloroquine available over the counter. It has been for many years in many countries. It's safer than a lot of things that are over the counter, even much safer than Tylenol or aspirin.
Right. Well, thank you so much, and we'll hope to talk to you soon. So.
Thank you.